Northern Michigan University nursing students are working with Little Brothers Friends of the Elderly to shed a light on how loneliness and isolation can affect the elderly. Local 3's Brianna McLean joins us in the studio with more. Brianna?
For many elders in the UP, living in isolation is already difficult enough, but dealing with it during a pandemic can have a big impact on the elderly and their health.
So nearly 1/4 of adults aged 65 and up were considered to be socially isolated before COVID. These numbers have gotten worse since COVID, but there isn't necessarily exact statistics yet. Older adults are at an increased risk for social isolation because of factors such as living alone, loss of family and or friends, chronic illnesses, and hearing loss.
Loneliness and isolation in the elderly can increase rates of anxiety, suicide, and depression.
There's a 4 times increased risk of premature death. There's a 50% increase in dementia, a 29% increase in heart disease, a 32% increase in stroke.
The students offer ways to help with loneliness.
We have first is adopting a pet. Obviously owning an animal can be a lot of responsibility, but it can be really rewarding. And if you've had past experiences with animals and if you have a love for animals, this can be a really positive way to find a connection during COVID. Also, you could join a club.
Other ways include making plans on days you know might be tough, such as holidays, schedule phone calls or video chats, doing physical activity, and creating a regular routine. To read more on how Little Brothers Friends of the Elderly is finding ways to help the elderly, you can visit our website, upmatters.com. Reporting in the studio, Brianna McLean, Local 3 News.